the outbreak, hospitals are having to cut back on their nursing staff. They've cut elective surgeries and non-urgent medical appointments, but there are still things for some of those nurses to do. Here's News Channel 6's Ashley Flette.
As hospitals and emergency rooms deal with a surge of patients affected by the coronavirus, clinics and other healthcare centers see a decline in elective surgeries, procedures, and preventative care such as annual physicals, well woman visits, and regular teeth cleanings.
We are using staff in maybe different ways than they would normally be used.
If a nurse's help isn't needed with patients fighting the coronavirus, it's likely needed elsewhere, thanks to some major technological advances.
Telemedicine allows us to continue to provide care for that patient in that setting. It's also convenient.
But Dr. Kuhl says before they start making any official changes, the plan is to continue to test more people.
What we're focusing on still is testing, making sure that we're testing appropriately, supporting the community.
The hospital has nearly 2,000 nurses and a list of questions to consider, so hospital leaders are always thinking ahead.
One of the things about disaster principles and in keeping with planning ahead is that we're already planning for getting back to normal and how do we get back to normal operations when we're over the peak.
And there are some nurses and doctors still having to scrub in.
Right now, what we're doing is focusing on surgeries where we don't want the patient to wait because they might experience harm if we delay the surgery.
But some consults don't even require face-to-face interaction with the patient.
If we just need to see you and ask how you're doing and if you're having side effects from your medicines and prescribe and refill your prescriptions, for example, we can do all of that over telemedicine.
As healthcare professionals work on getting back on their feet after COVID-19 is over, Dr. Kuhl says telemedicine is likely here to stay.
Our providers are going through that right now. They're learning it, but as they're learning it, I think they've found out it's a very valuable tool that we will be using far after this pandemic is over.